Good afternoon. I'm George Latimer, Westchester County Executive, and this is Thursday, March 11th, and we're giving our second Westchester coronavirus update of the week. As I'm sure you know by now, we've been giving updates on Monday at the beginning of the week and then on Thursday near the end of the week to try to give you a sense of what's happening in terms of our dealing with the coronavirus epidemic and outbreak. Now it is in its 13th month. We'll talk a little bit today about the numbers and about vaccinations. I'm joined, as I am each week, by my Deputy County Executive, Ken Jenkins, who's with us here. And we have a special guest. We're going to bring her on to talk a little about her community, the mayor of the village of Bronxville, the Honorable Mary Marvin. Mary, thank you for being with us today. As you know, we invite mayors and supervisors from different communities to join us so they can talk a little bit about what's happening in their community. And while everybody may not live in any one of these communities, it's important for you to see your chief elected official in your village, your town, or your city and what they're trying to do on COVID and any other issue that the mayor or the supervisor thinks is important. So we're very happy to have Mary here to talk a little bit about what's happening in Bronxville. Then a little later in the program, we're going to have our Commissioner of Health, Dr. Sherlita Amler, with us here. She's going to talk about some of the issues that involve a little bit deeper knowledge of the vaccines and what comprises the vaccines. Those of us who are in general government do not have professional knowledge. She is by profession a pediatrician, a medical doctor, as well as experienced in public health. So we're always happy to have Dr. Amler with us. We'll start with the numbers so you have an idea of where we are. You can look at our dashboard that we've created based on the state numbers that we receive. We give as much information as the state releases to us, so we can show number of active cases, total cases. We can show some vaccination statistics, which I'll share with you. We have the breakdown of cases by municipality. We'll also touch on, as we always do, hospitalizations and the fatality information, so you can get a sense of where we are. The general sense is that over the last 6 weeks now, we've seen a significant diminution in the amount of the spread of the virus. That doesn't mean it's not spreading. It just means it is not spreading in the same degree of wide nature that it was previously. We had a real spike around the holiday season. We're now 2.5 months after the holiday season, and we're seeing a reduction in that. And it represents itself in the following way. So the numbers that we have is today, this is from the tracker, from the New York State Department of Health workbook. You can find it online yourself. And that's as of today, Thursday, March 11th data. We have right now 5,584 active cases of coronavirus in Westchester County. That number you won't find on the tracker itself. That number is a simple subtraction of all of the cases that we've had to date in Westchester County, which is 111,713, less all the number of cases that were identified 2 weeks ago, which is 129,000. So the difference between those two numbers is 5,584, and those represent people that have been tested in the last 2 weeks, positive for COVID, and have not yet cleared the 2-week period of time that you need to clear in order to be considered having overcome the virus in your system. And when we give you some other statistics, that will represent the depth of the spread of the illness. This is the breadth of the illness, how many people have come down with COVID. And again, 111,000 plus Westchester residents have tested positive for COVID at some point in time over the last 12 and a half months. The vast majority of them have cleared the protocol for COVID, but there's still 5,500 that are not yet. And just to give you a parameter, from a week ago, same date, 1 week before last Thursday, we had 6,019 cases. So we're down almost 500 cases from where we were 1 week ago. And if you want to go back 1 month ago, and February and March have the same dates as well as days of the week, Thursday, February 11th, 1 month ago today, we had 7,922 cases. So in the course of a month, we've dropped 2,400 active cases. That is good news. That is movement in a good direction, less cases. When we dealt with the second bell curve of infection, we were down during the summer months. We came back up during the late fall and got up at a peak during the holiday season into early January. We were at a peak of 11,500 cases. So to be down now to 5,584 cases is almost half as many cases as we had at the more recent peak. So it's all good news. However, the reduction in active cases has slowed. We had some weeks over the last 5 weeks where we were dropping, 1,000, 2,000 cases a week. Not as dramatic a drop right now, but we're hoping to continue to trend in the right direction. We've tested 2,191,572 tests in Westchester throughout the course of the pandemic. Of course, there's in round numbers 1 million Westchester residents, so this averages about 2 tests per person. There are still some people that have never been tested, and of course, there are people who have been tested multiple times, either because of their occupation or their potential exposure to the disease. But whatever it is now, certainly the testing component has really come a long way. And if you remember, and I know Dr. Amler does, if you go back a year ago, which is right about the time now the index patient came on March 3rd, we were starting to deal now with the shutdown of the society by the 10th, 11th of March. We had only one place to go to process testing, and that was in Washington, a federal level. And then a little bit later on, we wound up with the Wadsworth Laboratory in New York State as the sole place for all testing. Now the testing is evaluated in multiple different places, and that's how we can get to 2 million tests. But if you don't test, you don't know who has the disease. If you don't know who has the disease, you can't contact trace. You can't isolate. You're not in a position to try to manage as best as you can the disease. So we've come a long way in a year to have the testing model where we're at 2.1 million tests just in Westchester County alone. You can multiply that by the state and elsewhere. Of the 5,584 individuals who have tested positive in the last 2 weeks, we currently have 264 individuals who are hospitalized for COVID. 264 individuals. Over the prior week, just 1 week ago, same date, we had 330 people that were hospitalized. So that's a significant drop just in a week. And if you want to go back to that date 1 month ago, we had 489 individuals hospitalized on COVID. So that's almost a 50% reduction in hospitalizations. People can get the disease, test positive, isolate, perhaps not even feel much in the way of symptoms, but those who are seriously affected by the disease wind up being hospitalized. So the hospitalization number tells us something about the depth of those that have been affected by the disease, and it's encouraging to know that we've gone down in a week from 330 to 264, or in a month from 489 people hospitalized down to 264, and we hope that's a trend that continues. We could be at a point where the number of infections don't really move much, but the number of hospitalizations drop dramatically, which may mean that people test positive for COVID, but they don't have a severe case. And there is a school of thought that the more of us that get vaccinated, it certainly prevents us from getting seriously ill if we get the disease, or from preventing us from having fatality. So all of those are good things and good trend lines. We have lost 2,139 Westchester residents over the 12 and a half months of the pandemic. We lost 5 individuals last night. We have lately been in the vicinity of the lower single digits, 2, 3, 4, 5 people per night that we've lost. That's still more deaths than we ever want to see. We'd rather see zeros. We had that happen last summer. We hope perhaps as the society opens up and we're outdoors more than we're indoors, we'll see less in the amount of fatality. For trend purposes, we track how many people we have lost in the week. And in the last 7 days, we've lost 23 people, which is a lot of people, but it's less than the 45 people that we lost in the week prior to that. And if you go back over those weeks, you'll see that we were losing in the 40s, and then prior to that in the 50s. And so the diminution in the amount of fatalities is an encouraging mark, but we're never going to be happy with fatalities until we have zeros. That was what will get us. But the general trend information that we're looking at, reduction in the number of active cases, a rather dramatic reduction in the number of hospitalizations, and an encouraging reduction in the number of fatalities, but not yet the magic number, which is 0. Now, we've talked about now, since the vaccines have come out in January, and we're having additional ones being approved each period of time. The most recent one, the Johnson & Johnson, Janssen Pharmaceutical vaccine, which we're encouraged by because it's a one-shot vaccine. The Pfizer and the Moderna vaccines are 2-shot vaccines. The one-shot Johnson & Johnson vaccine becomes very workable for those of us who are responsible to give out vaccinations. That one shot would be sufficient for individuals, much easier to deal with homebound. We'll talk about that in a second. Much easier to deal with people when we have to create a whole pop-up medical clinic and then shut it down and then reopen it 3 to 4 weeks later in order to give a second shot. So it's a lot easier for us to reach more people with the single shot J&J. But we are given allocations each week of Moderna, Pfizer, J&J based on the state's allocations. We put in a bid for a certain amount of vaccine doses each week. We get back a certain amount. It's never what we ask for, but that's okay. What we get, we use. We try to use it effectively, and we try to reach those different constituencies that have been authorized by the state in terms of eligibility, and those categories have expanded. We'll talk about that in a second. On the vaccination side, the numbers are encouraging because it is an accumulative number. The more people that get vaccinated, the more we believe we are reducing the possibility of our neighbors and friends getting the disease. As you may have seen, I had my first dose. I have a Moderna virus dose given on Friday. I was none the worse for the wear. My arm was stiff on Saturday, felt fine on Sunday. I've had no adverse reaction. I've also learned not to go on the internet looking for what people say, because different people have different reactions, and human nature being what it is, you look for the person that had the worst possible reaction and you get yourself scared. You don't want to convince yourself of anything else other than this is a necessary thing for your health, and it's a heck of a lot better to have a stiff arm for a day or 1 day's worth of reaction than to potentially be vulnerable to a virus that has killed 2,139 people. So with that, the vaccination numbers are very encouraging. At the county center, we have now administered just today our 100,000th vaccination. Now we're including both first and second vaccinations. So the 100,000 number is not equal to the number of people, but the number of people is still very high in that total, because the number of second shots are always lag the number of first shots, because it takes the 3-week interval to get there. So over 100,000 vaccinations given out at the county center. And the better news is that when we started out at that facility, we were doing about 1,000, a little over 1,000 a day, 1,100 I think was the number I used at the time. We are now over 2,500 vaccinations being given out at the county center, and it's going up to 3,000 per day. And the only impediment was the amount of vaccine that we received. The more vaccine we receive, the more that can be administered. The county center and the Yonkers Armory facility are vaccine centers that the state is directly involved in. They have a direct supply of vaccine to those locations. They don't come through the county allocation. So all we worry about as county officials is to work with the state and Westchester Medical Center at the county center to help make things move smoothly. We have Parks Department personnel inside to help make the flow work. We have obviously outside the county police, Department of Public Safety police there to help with some of the physical logistics outside and helping some people who may be infirm get inside. But in general, the county center has gotten high marks from people that have gone there for their vaccines. We're encouraged by that. I don't take personal credit for it. I share that credit with the people who are on the scene, the people in the health department, the people with the Westchester Medical Center, the state and local officials that are helping make that happen in real time. But the county center has been positive. It has not been perfect. When we've had snowstorms, we've had lines develop because of the demand to come at a certain time that exceed exactly when appointments are. And any one individual might have some logistical issues when they arrive. But in general, the county center has done a very good job in getting up to over 100,000 vaccinations. We have 2 clinics that are operating. We began with our traditional White Plains Health Clinic, one of our 2 county-wide health clinics. They are under the direction of Dr. Amler and her team, and they've been very efficient at giving out vaccinations for all kinds of things. I went there for my annual flu shot, which she has made sure I have every year, and they have worked very well under the direction of Lori Smittle, who has a doctorate in nursing and is one of the prominent folks over there that helps us. And, of course, the medical doctors that are under the direction of Dr. Amler, Dr. Wang, Dr. Hewlett, so many other fine individuals. But the health clinic is one part of a 2-location system. The other clinic we've set up is temporary, and it's in the gymnasium over at the Westchester Community College. That facility is larger, can accommodate more people. So between the 2 locations, first shot, second shot, trying to make as many people as we can. And we have broken over the 20,000 mark at those 2 locations. And we're very encouraged about that. And we've had some of the numbers that are included in that 20,000 number, including county pop-up vaccination locations. This gets very complicated. Trust me, it's complicated for us. We talk about this all the time. There's different constituencies we're trying to reach in different ways. No one strategy works. You have to do multiple strategies to reach the most number of people. But we have started in at least 2 occasions this past week with pop-ups that the county health department is managing. And we had one in New Rochelle earlier this week for those tied to the housing authority. And then we had a multiple-day one in Yorktown at their community location on Commerce Street in downtown Yorktown Heights, which served people from northern Westchester, primarily Yorktown, Cortland, and Somers, but not limited to that. And in that location, we had a direct allocation of a vaccine that were the Johnson & Johnson vaccines, and it's a heck of a lot easier to do a pop-up with the J&J one shot than it would be, as I said earlier, to shut it down, come back in 3 or 4 weeks and set up another one shot. So we're very happy, and we want to thank publicly the officials of Northern Westchester that helped make this happen. I want to compliment again our team, led by Dr. Amler and her effective individuals. We've had work from Chris Steers from our executive team in making sure that happened, and there are others as well that deserve credit. Emily Saltzman, our Deputy Director of Operations, is very much involved in these things. And I want to thank Supervisor Matt Slater, Supervisor Linda Puglisi of Cortland, Matt Slater's of Yorktown, Linda Puglisi of Cortland, and Supervisor Rick Morrissey of Somers, who particularly went out of their way to make sure that we filled the slots. The governor's pretty insistent that we use all the vaccines, and we want to use all the vaccines. We don't want there to be any missed opportunities. And so to make sure that we didn't miss any opportunities, those local governments went into overtime. And this level of cooperation between the county and the municipal government is absolutely critical. It has to be bipartisan or nonpartisan. It has to be practical-minded, nothing where we step on each other. Just we work together and we try to get as many people vaccinated as possible. And so that particular pop-up had very solid success, and those numbers are included in the 20,000 number. Now, the Yonkers Armory is the second mega vaccination location in Westchester County. That is a joint product of the federal government, FEMA, and the state government. And now down in Yonkers, it's just really started to get underway. We've had over 8,000 vaccinations to date. That facility will start to crank at a higher level as we go along. And we're very hopeful that that will help greatly. Its presence in southwestern corner of Westchester County will help us in that corner of the community, and we're certainly looking for other opportunities to provide either temporary or more permanent sites for vaccination to get us where we want to go. But in the aggregate, those 4 locations are the 4 largest focuses. There's a Latin word that's the multiple of focus, but I forget it now. Didn't do that well in Latin. But it's the county center, the community college, the White Plains Clinic, and then also the Yonkers Armory. And as we add to that, that'll give us greater coverage. I've been given the statistic that as of earlier this week, 24% of Westchester residents 18 years of age or older have received at least their first shot of the vaccination. That would include people who got the one-shot J&J and those who got the first shot of Pfizer or Moderna. And that is a good sign. The first shot for Pfizer and Moderna is not the final product. You need the second shot to be fully protected. You need to wait a couple of weeks after that to have the full benefit of it. But nonetheless, to get the first dose out to 24%, almost a quarter of the county, is a very positive sign. And ultimately, the more of us that get vaccinated, the less of us will get the virus. And the less of us that get the virus, then we'll see the numbers start to come down in active cases. We'll have a more manageable situation. And then as we turn to our health professionals, we'll start to determine how much of our society we can open. We're more open today than we were a year ago, and we want to go further. We'll talk about that again also before this hour update is over. But we're very encouraged that these situations are in good shape. We do understand that of the 24% that have gotten at least one shot, 13% of the population, close to 14%, have received either both doses of Pfizer and Moderna or the one dose of J&J. So they're completed. That means 13.6% of Westchester residents are completed in their vaccination, and another 11% are on the way to being completed. And so all of those are good numbers, and it doesn't really matter where they were vaccinated. There are local pharmacies that are vaccinating people at various numbers. We have some state pop-ups that have existed. There are more that are coming. Some are coming back for the second shots. All of that is important. We know that the best way to reach people is to make it convenient to them. There's less stress when you get a vaccination closer to your home. When you're in a place where you may see other people that you know, it reduces some of the anxiety that comes out of that. So that is why, while we have a county-wide effort, and it's under the direction of the state, we want to stay very local and very close. And the examples I gave you of our working with the supervisors in the northern part of the county extend to those all across the county. With that thought in mind, we've invited Mayor Mary Marvin from Bronxville to come and join us to tell us a little bit about what's happening in Bronxville vis-a-vis COVID and everything else, with the hope that with all 45 communities we can form a solid partnership, resolve this issue, and as soon as we can, put COVID behind us. So with that, the mayor of the village of Bronxville, Mary Marvin. Madam Mayor, thank you for being with us.
Thank you, County Executive Latimer and Deputy County Executive Jenkins. I'm really here to, first of all and most importantly, say thank you. Give credit where credit is due. When I talk to my residents about their experience at the county center, in getting their vaccines. Words like professional, efficient, organized, knowledgeable, and most importantly, probably compassionate comes to mind. So I am here to say a heartfelt thank you, because the more people in any community that gets vaccinated, the lower it takes away that angst and brings back the vitality of the community. Also, frankly, a big thank you. We were kind of ground zero at our New York Presbyterian Lawrence Hospital with early patients over a year ago. So our partnership with the hospital really has served as a model of just good connection. But I'm really here. My passion is for everybody. We're going to come out, the lights at the end of this tunnel, and we have to support our small businesses. They are the lifelines of our community. And they're the people who give to the schools, they give to the church. They're the ones that the synergy, they hire each other, whether it's an accountant or a computer programmer. So please just think, as you're getting vaccinated and feeling a little better about everything, please support the people who day in and day out support us, because Westchester County, to me, the communities are so wonderful, small, large, and our businesses in Westchester are our heart. So I guess I'm here to just say keep up the incredible generosity that I am seeing all over the county. And County Executive, you set the tone. Thank you.
I want to thank the mayor very much for coming, and just a quick anecdote along those lines. I make it a point to try to be in as many different parts of the county as I can. I grew up in one part of it. I live in a different part of it now. So I've learned to appreciate the diversity of Westchester County. 2 weeks ago, I went to Mass, Roman Catholic, went to Mass on Sunday at St. Joe's in Bronxville with a friend of mine. And we decided to have brunch at Underhill Crossing, lovely place right on Pond Field. And when we left to walk back to get to our car, I was walking on Craft, and a woman happened to recognize me, I guess, from this. And she said, "What can I do to get a shot?" And I said, "Give me your name," and so forth. As it turned out, she was eligible because of her age. We submitted her name, and I just got a very nice card from her. She lives on Louisiana Avenue, in one of the apartment complexes in Bronxville. And, it's just that kind of hometown situation that we have to try to get to. I'm not unmindful of what's happening in the world of politics today and the difficulty of getting people who hold different political views to work together. But in this case, it's one big hometown. And you may not live in Bronxville, and you may not live in North Salem or Yonkers to Portchester, but we're facing something, all of us together. And that one woman who we managed to get a vaccine for, and no special connection, she mentioned it to me on the street, got her name, done information. She and her husband both were eligible, and they both got the vaccine, is one more example of how we can work together and hopefully solve problems. So, Madam Mayor, thanks for coming. We appreciate to be with us here, and we want to let her get back to Bronxville and do the things she has to do. Now, there's a series of policies that are coming out of the state. As you know, from just about this time a year ago, Governor Cuomo set in motion executive orders that gave him the authority to make the decisions necessary statewide. So whether you're the mayor of New York City, the county executive of any county, mayor of a village, supervisor of a town, all of our authority was subsumed under the governors, and the governors set out game plans on what would happen to businesses and testing and data and now vaccinations and so forth. So they've set out some new vaccine guidelines, and it gets tricky. And what we suggest anybody to do is to go onto the New York State website, and you'll see different policies that are there. It's going to be hard to read sometimes. It is structured in legal language, not in everyday conversational language. But what has done is a couple of different situations here, and they've set guidelines for us, which then become the priorities of how we, in our controlled administration of the vaccine, target different types of groups to satisfy eligibility and make sure there's a wide spread of all the different eligible groups. So, the governor did open up for those who are 60 years of age and older. It had been 65 already. So those in that 60 to 65 range started on Wednesday being able to be vaccinated. And then also he added to the list of essential workers, which began with hospital workers, then expanded to police, fire, sanitation, and taxi drivers and restaurant workers, and a host of other different occupations. He's added, beginning next week, all those who are government workers who are in public-facing responsibilities, and that can be any number of different people that are out in the public. Certainly the DPW employees, Parks Department employees who are interacting with the public now are eligible to get the vaccine. We're going to take a look at what we can do for the poll inspectors who are going to be working the various village elections that are coming up. There's about 8 or so villages that have village elections, and the people who sit behind the desk, even with a shield and with a mask, we're going to see how many of those folks we can help now qualify for vaccinations if they haven't gotten it already. Many of them are eligible already by age, but now by occupation, if they fall under the age of 60, that would be helpful, because if you're going to go out and vote in Portchester or Tuckahoe or Hastings or wherever else there are village elections, you want to have the comfort of knowing that you're not going out and putting yourself in any kind of jeopardy or spreading the disease. This week, there's some focus on the restaurant workers and grocery store workers that have been made eligible, transportation individuals from Liberty Lines buses, which run our Beeline bus system. On Friday, we're focusing on teachers. We hope to have as many as 800 teachers from 26 districts receive vaccination. And it's important for teachers because the more teachers that are vaccinated, the easier it is to open our public schools. I have said now for well over a month, we need to open our public schools. Those decisions are made by the local school districts and the school superintendents, who we talk to every week. But in order for them to have the flexibility to do that, they need to know that there's an effort being made for the teachers and other educational personnel to get vaccinated so that they're comfortable going back into a school environment, and then we can overcome one of the major obstacles for opening our schools. So we're trying to do that, and this Friday we're going to be dealing that. We have a poll out there to the different districts. The number of teachers and educational employees in the county is a very large number. It's larger than all the police and fire added together. So hopefully we'll make some progress on that. We're looking forward to another large order that comes in on Tuesday. This is the headache of Joan McDonnell, our Director of Operations. She and Emily Saltzman have to manage the actual flow of vaccines as they come in, make sure they get to the right location, and they're used in the right fashion, and that is not a simple task to do. And by the way, none of us have done anything like this prior to the last year, and the vaccines have only come in since January. So you're looking at us constructing the vehicle as we drive it. And this is a matter of learning as we go along. We may make some mistakes along the way. We learn from those mistakes. We admit them candidly. We fix them, and we go forward so that we try to get the vaccines out to everyone possible. When the day comes, and we're told it may be coming within 60, 90 days, that there's enough vaccine being produced for every person over 18 to get a vaccine, then our vaccine distribution is going to be completely different. We're not going to worry about eligibility. Everybody will be eligible. And we're not going to worry about having set locations for it. We'll distribute it as widely as there are places to give out vaccinations. But for the moment, we have to manage the supply that we're given, which is less than the demand that exists. We are hoping to get an infusion of Johnson & Johnson vaccine at the end of the month on March 29th. That is the tentative plan. And again, because it is a one-shot vaccine, it has its advantages in being able to reach some things. Now, in ground zero for everything that's happened over the last 12 and a half months is Dr. Sherlita Amler, who's our Commissioner of Health. And you've seen her and I together. We've done numerous interviews now. And it's always a little interesting because Dr. Amler has the professional knowledge of health, and I do not. And I ask her questions, but I ask them the way an average person would, because you don't have expertise. And even with all of her training, she consults with other medical professionals, and they confer what are the best practices and how do you interpret these things. And there's a certain amount of this which comes down to your best professional assessment of something without it being absolute and rigorous, because it's not a clear, hard line. And so there's many times that issues have been thrown at her, no time left on the clock, make a decision, we have to do this or not do this, and how do we instruct people. And where she does have a knowledge of public health, she doesn't necessarily have a knowledge of how high school sports functions best. That's not part of training in med school. So as these things are thrown at us, we try to work together as effectively as possible. She's been a terrific partner in all of this. I'm very grateful for her and her department's professionalism, and we're going to ask her to talk a little bit about vaccine safety and particularly the Johnson & Johnson vaccine. We have a little video that we're going to show first, and then after you see the video, Dr. Amler, you'll see the real Dr. Amler behind the microphone. So perhaps we'll share that video as a preparatory to Dr. Amler's commentary.
Hi, I'm Dr. Sherlita Amler, Commissioner of Health for Westchester County. Facts are that more than half the people who are infected with COVID-19 and are spreading this infection have no symptoms. So for me, getting the COVID vaccine is the right choice. It helps you protect everyone you love and care about from this terrible, dreadful virus. The COVID vaccine is safe, and you will not get COVID from the vaccine. Distribution will be fair and equitable, and it will be free to everyone. You could have the infection, spread it to others, and be totally unaware of it. So don't let that happen. Get the vaccine, protect everyone you love and care about, and let's end this war.
Let me turn the microphones over to Dr. Sherlita Amler. Dr. Amler.
So thank you. Good afternoon, everyone. So my task is to just talk a little bit about vaccines. And luckily now we have 3 vaccines at our disposal to use. And all 3 of these vaccines, what they basically do is they train our body to recognize a certain protein, a protein that is a tiny piece of the spike protein on the exterior of the COVID virus. And it trains our body to recognize that protein, and as a result of that recognition, make antibodies that can then fight COVID disease and prevent us from becoming sick and hopefully preventing us from dying. So now we are luckily, we have these 3 separate vaccines. We have the Pfizer vaccine, we have Moderna, and we have the Johnson & Johnson. And so how are these alike and how are these different? Well, basically, the Pfizer, if you had a family member that was between the ages of 16 and 18, this is the only vaccine that they would be eligible for. So if they had some underlying medical condition that currently makes them eligible for to receive a vaccine, they would only be able to receive the Pfizer vaccine. Moderna is anyone greater than 18, and that is also true of the Johnson & Johnson, anyone greater than 18 years of age. The Pfizer and the Moderna require 2 shots, but the timing between those 2 shots is a little different. Pfizer is 3 weeks apart. The Moderna is 4 weeks apart. Now, this means you shouldn't get the shot any closer together than 3 weeks for Pfizer or 4 weeks for Moderna, but it doesn't impact how far apart they're apart. So let's say that you couldn't get that Moderna shot exactly at 4 weeks and you had to wait till 6 weeks. You would not have to restart the series. And so people should know that there is time on the other side, that if you're delayed getting that second dose, we do want you to get that second dose because you would not be fully immunized till you do. But it doesn't mean that you have to start all over. The beauty of Johnson & Johnson is that it is a single dose. So as soon as you get that single dose, and 2 weeks have passed since that vaccine, you are considered fully immunized. Whereas with Moderna and Pfizer, you have to get both shots and then wait 2 weeks to be considered fully immunized. So there's a real advantage to the Johnson & Johnson because as soon as you get that shot 2 weeks later, you're fully immunized. We consider you fully protected against COVID. There have been some rumors around Johnson & Johnson. I just want to dispel these rumors. Johnson & Johnson does not cause infertility. There's no infertility risk associated with any of these viruses. Also, Johnson & Johnson does not contain any fetal tissue. So rest assured about those 2 things. Effectiveness. Some people want us to give exact numbers. Pfizer is this effective. Moderna is this effective. The reality is that these things are all studied a little bit differently. Their trials are not exactly the same. And so it's a little bit like comparing apples and oranges. But what I can tell you is that all 3 of these vaccines are effective against preventing serious disease, but more importantly, against preventing death. And the bottom line is, even if you get sick, you don't want to die from COVID. So your best chances if you get COVID, or if you're unlucky enough to get COVID, is to hope that you have at least been vaccinated, and that will provide enough protection that you won't end up getting serious disease or dying, but hopefully you will not get disease at all. And that is our goal, is to prevent people from getting COVID at all. Because obviously if you don't get COVID, you can't spread this disease to others, and that's our primary goal. Why do we need people to get vaccinated? Because we want to reach herd immunity. To reach herd immunity, we need between 70 and 80% of our entire population vaccinated. Currently, right now, as I said, we can't vaccinate children, but all three of these companies are looking at trials to try to develop a vaccine that can be used in children, and there are currently trials going on for the 12 to 18-year-old population, and we hope we will have a vaccine for that population soon. But until we do, it makes it even more important for adults to get vaccinated so that they are protected against COVID and they cannot spread this virus to those individuals, whether it's children or people with immunocompromising conditions that for whatever reason make them unable to get the vaccine. So I think I've covered most of what I wanted to say today, except that when people ask me, what choice should I make as far as getting which of these vaccines should I get, I think that things to consider are one, age. As I said, children 16 to 18 only can get Pfizer. If you have people that are homebound, have difficulty getting out, for which going twice to get a vaccine is a real problem, then I would really strongly suggest getting Johnson & Johnson. But the bottom line is they're all effective. They'll all protect you. So whatever vaccine you can lay your hands on is the vaccine you should get, and as quickly as you are eligible and able to do so. Thank you, sir.
Thank you, Dr. Amler. I think it's very important for all of us to understand, particularly those of us, most of us as laymen in these medical areas, that we're not experts, and perhaps our questions can't ever be completely assuredly answered. But we take a sense of risk in everything we do. We risk ourselves when we get behind the wheel of a car. We know that the greater likelihood is that we're going to arrive at our destination. We know how to drive the car. We know how to navigate through traffic, but there's always a chance of a problem. We get on an airplane, the same thing applies, and in 1,000 things, we take a certain amount of risk. There's fear when there's something new, but I think right now we've seen pretty clearly what the alternative is to vaccination. The alternative is to leave yourself open to a disease that has taken the life of over 2,000 people and has affected some of the people that have recovered. We hear stories about people who have not died, but they've been affected. They've had some lingering issues to respiratory and otherwise. So I think Dr. Amler is very straightforward in laying out the case, and I hope people hear the case, those who are watching now, those who will find this information from other sources, that they'll make the prudent decision, which is to get vaccinated and put ourselves in the best possible position to avoid getting the disease. Next, I'm going to ask Ken Jenkins to cover two areas here, both the travel policies that have been established, and then talk a little bit about some of the eligibility that has opened up for local governments. So Ken Jenkins, Deputy County Executive.
Thanks, George. And as the county executive mentioned right from the very beginning, with the numbers of people getting vaccinating improving, there is a huge tendency for people who want to travel some more. And the CDC, Dr. Walensky from the CDC, did mention the new guidelines from the CDC. The governor in New York State put out new travel guidelines yesterday. And as the county executive said on the New York State website, it could be confusing to do that and look at those particular guidelines. But I'm going to try to break it down just a little bit for just one component of the travel changes, and that is for people that are vaccinated. So the county executive said in Westchester County, we have approximately a little bit over 34% of the people that have gotten at least one shot, one vaccination, one dose of a vaccination. And there's 24% that have gotten, 24% that have gotten the two vaccinations, one shot of vaccination, and 13.4% that have gotten at least one shot. Dr. Walensky talked about why the CDC did not have additional travel relaxations happen, because across the country, there's only about 9% that have gotten one shot. So to put those in real numbers, we have approximately a million people in Westchester County. If 10% of our population have gotten one shot, or are fully vaccinated, that's 100,000 people. But that is not, it's 1 out of 10 people. So if you have had both doses of the 2-dose vaccines, which are Moderna and Pfizer right now, or your Johnson & Johnson, Janssen, the 1 dose, that means you're fully vaccinated. 2 weeks after that, as Dr. Amler just said, you are considered fully vaccinated. If you are traveling outside of the contiguous states of New York, you do not have to quarantine. If, again, both doses, 2 weeks after that, 1 dose, 2 weeks after that for Johnson & Johnson, within 3 months of that final shot, the final dose. So 90 days, 3 months after the final dose, and you are not been around somebody that has been symptomatic with COVID-19. So if you have all 3 of those items met, then you do not have to quarantine if you are coming back from one of the non-contiguous states and traveling. That does not include international travel. It is just national travel or to one of the territories like Puerto Rico. While no longer required, New York State Department of Health still recommends quarantining after the domestic travel as an added precaution. So again, it's a recommendation to do that, but it does not you do not have to do that if you are vaccinated and you meet all of those criteria. So if you get your second shot today or your second dose, we want to try not to say shot, your second dose of vaccine from Pfizer or Moderna today, doesn't mean that you can just skip over those quarantine requirements for travel. All travelers still have to fill out the traveler's health form. That is also on the New York State website. You also get it when you come through an airport. You have to do that still, and you should still continue to adhere to the safety guidelines to stop the spread, still wearing a mask in public, socially distancing, and avoiding gatherings. So again, that is what the Governor Cuomo announced yesterday, and again, it's for domestic travel. In light of those additional declarations, front-facing municipal employees are going to be able and eligible for the COVID-19 vaccine. Westchester County has begun to organize an opportunity for those workers to receive the vaccinations. We're under the understanding that we're going to get the Moderna vaccine for that particular distribution to those front-facing employees. And, when we say front-facing, I know there's a lot of people that are trying to think, what does that mean exactly for me in that particular category? Is that pre-pandemic? And that actually would be the case. It's not pre-pandemic. It's what's happening right now. We have many businesses that are still working remotely, and you may not have that interaction. So as the county executive mentioned earlier, the individuals like Public Works are one particular opportunity, the people doing transportation, and we are planning to have front-facing municipal employees that opportunity to have that first vaccine on March 18th or 19th at Westchester Community College. That those individuals will be communicated with through their municipalities and through those local governments to be able to sign up for those opportunities. And again, no matter what, appointments are still required. So whether you go to the Am I Eligible website, which the governor stated that every location will be able to administer vaccines to every eligible person, which is a big change from, as the county executive said, the directions that we've been given in the past to vaccinate X group amount of people at this site, with the exception of local pharmacies. Local pharmacies are still restricted to those folks that now are 60 years or older for vaccination appointments. The folks with all the other eligibility criteria can go to any of the mass vaccination sites, and they can go anywhere in the county. We went on the site earlier this morning around 8:30, and there were vaccine appointments available at the Javits Center, at the community college, at the county center, but those vaccine appointments were sometime in May. So you should realize that the vaccine appointments, because we've been told 3 weeks out, the vaccines that we're getting, people are now allowed to make appointments out. So you can get that vaccine appointment online, but keep in mind it still may be out. Bottom line is that we're trying to work through this effort As more vaccine comes in, it is a definite challenge. County Executive mentioned all of the folks on the team here that have been doing tremendous work. Dr. Ambler's team, certainly Joe and Emily, taking care of that with all of the people, every county employee that's been engaged in this process, with the partnership in New York State, the National Guard, and all of our municipal partners to be able to get this particular thing done. We know we have a light at the end of the tunnel, but we know we just got to keep holding on and being patient while we're getting through this process. Thank you so much, George.
Thanks very much. Thank you, Ken. I want to just make one other point for those of you who don't consult the map on a regular basis. Ken talked about contiguous states and non-contiguous states to New York. Those states that border New York State in general are New Jersey and Connecticut. That we know clearly. Pennsylvania borders New York, although not in our immediate area. So does Massachusetts and Vermont. So those are the contiguous states that we're talking about. A non-contiguous state would be any of the other 50 states. But bordering us, New Jersey, Connecticut, Pennsylvania, Vermont, and Massachusetts. We want to talk a little bit about homebound seniors. The shots for homebound seniors, we are right now working with Empress Ambulance Service, and we're working with them to distribute Johnson & Johnson vaccinations to homebound seniors. Homebound seniors are unable to leave their homes and go to any vaccination location, even if we put it around the corner from them. Their health is such that they have to stay inside the home. The folks who get a Johnson & Johnson shot, single shot, does not need a second shot, makes it more workable for us to do that. We want to thank Empress for this initiative. It's very important, and they've been very helpful to us. We have 180 individuals that have been identified so far under this program. We know there are many more out there. I had conversations today with representatives of some of the other communities. But we're going to make sure that everybody gets a vaccination who needs one and wants one. I mentioned earlier in the update that we had 2 successful pop-ups that were county-sponsored pop-ups. One was in the city of New Rochelle on Monday, and the other was located in Yorktown and benefited some of the communities in northern Westchester. New Rochelle provided logistics and volunteers for the New Rochelle site, and the town of Yorktown provided logistics, support, and volunteers for the Yorktown site. In both of those 2 cases, we're receiving a supply again of Johnson & Johnson doses, and it was targeted for people 65 years of age and older. During this period of time, we were able to administer 248 vaccines in New Rochelle and 716 vaccinations in Yorktown. The Yorktown, again, was a 2-day period of time that stretched out into multiple communities. And so we're very encouraged that that's a good direction. As we get allocation from the state, targeted for either 65 or any other particular cohort, we're going to try to use this. Again, with Johnson & Johnson, we have a convenient dose structure, 1 dose, that helps make this happen. We've communicated with the state of New York for guidance on school graduations. Now, we know that a year ago we had a situation where the governor set regulations and reduced what could be done, number of people indoors and or outdoors. As schools go back into session, those who are seniors this year and graduating are, like last year's graduating seniors, going to have a difficult senior year. It's not going to be the usual fun and some of the things you kind of look forward to if you've been, working your way up to the graduation year. And it's probably true for our college graduates as well. But in each of those different cases that our teachers are trying to be vaccinated, our school districts are preparing for a broader reopening, and there are certain questions that have been raised. So we've communicated with the state of New York on behalf of the 44 school districts to try to put this on the radar screen so the decision makers can come back with a protocol that they want. You may recall last year that we made available some of our county facilities to handle drive-in graduations. A number of them used that. Rhinebeck High School was one. There were some others. And this year will be a little bit different. We won't be able to have playland available for that purpose, but we do have Croton Point Park and a couple of others. But that's really the small portion of it. The larger portion of it is the decision-making so that Westchester County school districts can start to make plans now as we're in the middle of March, before the end of the March, for what's going to happen in June. It certainly takes time for these logistics to be worked out. And it's important as well for us to deal with the ramifications of the state's travel provisions. We had last year a spike of a problem in Chappaqua because people had traveled just before high school graduation, did an outdoor graduation, connected with people, and we were concerned that that would represent a big a big expansion of the number of people with infections. It was an expansion, but it did not, get beyond a manageable number, a couple of dozen. So we're concerned about that going forward, and we're asking New York State to provide guidance on school graduation so that we're on top of it. The graduation is administered by the school districts, but again, our county health department has a role to play in enforcing whatever the rules are that come down from the state, and we'd like to have that opportunity. We want to have a ceremony that recognizes and celebrates the accomplishments of the young people who have reached this major point. We talk about graduations as also commencements, and that's exactly what they are. You are graduating from one level to another level, but at the same time, you're beginning something. You're commencing the rest of your life, in many cases, to go on to college. So we want that to be as good an experience as possible, given the fact that we've just gone through a year of remote learning, which has not been easy for the students of Westchester County and anywhere else in the nation. We have the standard vaccination information. You've seen it before. It is on our website. It gives you information that we're in phase 1A and 1B. You can see am I eligible.covid19 vaccine. That will give you the information to walk through and the different changes in eligibility. Meaning that they're going to change the website. Hopefully it's changed by now. You can go on to make sure that they give you information. It provides you the hotline number, the 833-697-4829 number. I don't expect you to remember it because I'm saying it verbally. It's on the screen, and hopefully that will be helpful. The vaccine form is also available. You may see it referenced on the screen, forms.ny.gov with /information. There is a formal form that you have to complete. That is available as well. Any of this stuff will be noted under a connection, COVID-19 vaccine, .health.ny.gov /what you need know. So you can try to get all this information. We try to give you as much information as we can. And we're going to close off our report today with a bit of good news that involves that which Westchester County has control over, and that's our recreation program, particularly our public golf program. You may recall that last year this was a major part of our updates. The golf course open, is it closed, and Bicycle Sunday, which we haven't yet reached the point for that, nor the beaches, nor the pools. We haven't reached the date for that, but we generally open our golf courses the second weekend of March, and that's exactly what we're going to do in 4 of our 6 golf courses. The accumulated snow on our 2 northern golf courses, Mohansick and Hudson Hills outside of Ossining and Mohansick and Yorktown, do not yet allow us to open up those courses. But the 4 down county courses, the 2 in Yonkers, Dunwoody and Sprain Lake, and the 2 on the Sound Shore, Maplemore and Saxon Woods, will open up this weekend for the first round of golf. It's a beautiful day today. It was a beautiful day yesterday. My friends who are golfers, they would tee off in pouring rain if they could, and if you give them good weather, then they're certainly going to want to be out on the links. We're only a few months away from having shut them down right around the holiday season, so they may play a little wet right now, and things won't be quite as ideal as they'll be a little bit later in the year, but we're hopeful. We may still get some bad weather yet. March and even April is known to getting some snowfall, so the courses will be open as long as the weather allows and the conditions are playable. But we want to open things up that we know will not advance the spread and that are important for people's recreational needs. And last year there was some controversy when we did some of these things, but the things that we opened up were managed well, and there was no connected advancement of the spread because of these things that we did, and we're going to continue in that direction. In everything, we're trying to be as practical-minded as we can. We're trying to not let one or the other ideology drive the train, open everything up, close everything down, but to be practical about what can and can't be done. I mentioned already we're working now on the protocol for opening up Playland. We intend to open it up the last week of June at the same time that we open our pools and beaches. We have a managerial challenge ahead of us to do that, but our professionals in recreation believe they can do it within the guidelines that our health department is advising. But the bottom line is Playland is in the future. Pools and beaches are in the future. Golf is in your almost immediate present, and we expect to have our normal opening up at our central and southern courses beginning this weekend. Golf is not a contact sport. It is socially distanced by structure. You do not get close to somebody when they're teeing off, and by courtesy, you don't even get in their line of sight when they're putting on a green. I don't play golf, but I follow the sport like I follow every sport, and the rules of golf allow this to happen effectively. And last year, we had the best season we ever had, or at least in the last 20 years of golf. We had 267,000 rounds played. That's up nearly 40% from what we did in 2019. Almost everything about last year was lower than the prior year. but not for public golf. We had a great banner year in public golf, and we hope that this will be a good year as well. The state has established percentages for indoor and outdoor dining, 50% capacity, move it up to 70% capacity a little bit later in the month. Takeout service is also available, and that's at our golf courses according to New York State guidelines. Golfers are required to wear masks and to adhere to social distancing. All of the other different paraphernalia in golf, the rakes and the ball washers and the flags, are removed from the course. The flag slips will be left in the hole. Golf carts are available and sanitized after every use. And we hope those who are out there to play golf have an enjoyable golfing season. We believe, based on what we know today, that we are going to have a better spring than we had a year ago. We expect to have a better fall than we had a year ago and a better summer than we had a year ago. Things will open up. More things will be available to us than were before. It's hard to imagine that we will be fully back to where we were before the pandemic hit, but it's really a question of how many people get vaccinated, what kind of spread we see once we get to herd immunity, as Dr. Amler said. And all of these things are yet for us to discover. But with every passing day, week, and month, we're learning something about how to deal with this pandemic. And we still want to move forward with the rest of our plans, the things that we think are important in a host of other policy areas. COVID is critical. It's a central attention, but we don't want it to be the only thing of attention. And we want to try to manage it and get through it as effectively as we can. Catherine Chaffee, our Director of Communications, is here. Do we have questions from our friends in the press?
Yes, we have one question today from David Proper from the Journal News. He says that the question is for you and for Dr. Amler. While cases have noticeably dropped in the last few weeks, they seem to have plateaued at around 300 to 400 daily cases. Do you think reopening of society is happening too rapidly?
Well, this is David Proper from the Journal News in LoHUD. We asked Dr. Amler to give a professional opinion. I'll give you my layman's opinion. I don't think in New York it is opening too rapidly. I think what we're doing in this state and certainly in our county is reasonable and appropriate. We are not at 100% of things. We are not opening every possible venue to full attention. We're not having our sporting events have full occupation of people. Right now we're working on trying to have a little more spectatorship at our high school sports. We're trying to do things that open up restaurants a little bit more. So I don't think it's a wide opening situation. Texas and Mississippi, I think Alabama, have moved in that direction. There may be some other southern states. There's a different philosophy in those states as they view the pandemic and as they view the way government interacts with the individual. They are warmer states, so they do not have the winter realities that we have that sort of close down parts of our society anyway because of the cold weather. But no, I don't think we're moving precipitously. And in fact, you can see that we've made some decisions to open some things over the last month or two. Some things have increased. We dropped the yellow zone and the orange zone designation, which had restrictions on restaurants. And even in the dropping of those restrictions, we have had a drop in the number of cases. I think the key dynamic is personal behavior, how a person themselves acts, and many times what they do within the confines of their own home, how willing or unwilling they are to show social distancing and sanitizing and things of that nature is probably, David, as important as anything else is. Keep in mind, we're going into the St. Patrick's season, and I'm of Irish heritage, and we'd love to have St. Patrick's parades, but we're not reinstituting St. Patrick's parades, and we're not reintroducing some of the joyous events where we pack ourselves in a social context. So we're not really reopening those types of functions which could really spread the disease. But that's a layman's point of view. I'm going to defer to Dr. Amler, who has a healthcare point of view.
Well, for a non-physician, I think the county executive gives really good medical advice, and I think he's exactly right in that, it's not just what opens, but what happens when we do open things, and people need to be personally responsible, and we know that wearing masks and keeping our social distance and using hand sanitizer is how we got to a point where we had very low cases, and it's how we will get back there with the help of the vaccine. But, where in some parts of the country you see people wearing no masks, not social distancing, not being responsible. I think New Yorkers have been very good about wearing their masks, doing social distancing, using hand sanitizer and disinfectants. And if we continue to be personally responsible, I think we can get where we need to be. Thank you.
Thank you, Dr. Amler. Catherine, are there any other questions from the
There are no
press?
more questions.
Okay, well, we thank the members of the press. If they have any other questions, they can communicate with Catherine. We'll try to answer them between now and when we see each other next on Monday at 2 o'clock, where we'll give you the next update. We'll see how we do over the weekend. Just as always, a couple closing thoughts. We are now literally now almost a year away from when we first began these updates. And, we did it at one point every day. We ratcheted it back to once a week, and then we moved it back up to twice a week. We don't feel the need to be here every single day, although we are taking an hour of your day to give you these updates, just to try to be as thorough as we can with lots of different points that go into it. And I think it's helpful to have individuals like Dr. Amler and Michael Orth, our Commissioner of Public Health, join us, and municipal officials as well to talk about certain things. I have mentioned this more than once, so it's really repetitious, but it was what I said on the very first of these public updates that we had almost exactly a year ago. We are undergoing a test, and now we're in the 13th month of that test. And perhaps my generation, I'll personalize it and not speak to other people of different ages. Our generation, not completely across the board, not those that happen to have specific things that happen to them in a cohort, but all of us in this generation have not quite had a test like this before. We have survived 12 and a half months of something that we didn't anticipate, nor did we have a roadmap on how to handle. And it is a test. It is a test of our intellect. It's a test of our perseverance. It's a test of our willingness to try to work through difficult logistics that we haven't had to do before, but we do that in order to try to be as close to normal as we can, even as we deal with something that is very much outside the side of normalcy. We have seen heroes arise over the course of the last year. We always point to our healthcare professionals. We've made quite a bit to talk about our public health nurses that went out in the very beginning of this a year ago in the face of the pandemic, and all of the others that did so much important work to help us going. And we have tried our best to grieve and honestly do so the people that we've lost, so that we show that, no, we're not automatons of government, we're human beings, and we understand that the loss of human life is real and it's emotional. But at the same time, we go on, that we look at the issues at hand, and whether it's vaccination or testing, which is still going on every day. Just today, we had an infection test rate for one day of about 3.4%. That's a good day. I don't want to generalize and assume that's the way it's going to be the next few days. But testing is going on even as we speak. And people every day are making decisions about whether or not they go out, where they go out, how they function in their everyday life. Do I work from the office? Do I work at home? Can I go out on a job site where I'm out in a public setting with other people? And we're trying to work through this. And in a sense, the fact that we've gotten this far, and those in medical science and pharmaceutical sciences have now delivered us a vaccine that gives us the chance to defeat the disease as best as we know, is an encouraging sign for all of us, and not just Americans, nationwide, worldwide. So all I can tell you is every day is one day, every foot is one step in front of the next foot. We go forward. We hope that a year from today we can look back on these moments and say, do you remember when we went through this, and not have the circumstances that we have today. But for as long as this challenge is there, we're challenged, and we're going to rise to the challenge. Not me, not the government, us. As human beings, as Americans, and as humans, we are going to rise, and we're going to meet this challenge, and we're going to defeat it, because we're people of purpose and we're people of substance, all of us, every single one of us. Together we will do that, and we'll be back with you on Monday to give you an update on how well we're doing over the next 4 days. I'm George Latimer, Westchester County Executive. Thank you for tuning in. Be safe, have a good weekend ahead, and we'll see you Monday.